Where do you find the most complex data sets in the world? On Facebook? At the CIA? No, at your local hospital. Systems for patients, medications, labs, all work independently. But they need to connect so nurses and doctors can deliver the right care. Those connections are called interfaces. Interfaces are complex because of the language, or the standard, of healthcare data. It's called HL7. You know the 3G or the 4G standard for your phone. It's pretty straightforward stuff. You're compatible or you're not, period. Well, HL7 is nothing like that. HL7 is all about interpretation. So, you have complex data plus HL7. The result? Far too much interface work is manual. This means busted timelines, busted budgets, and busted projects. You've read the news lately? Analysts spend weeks just trying to figure out how the data is organized. It's usually a trial and error experience, and there's no documentation available. Then they have to do it again and again, whenever there's new equipment or upgrades. Talk about a challenge. This costs the healthcare industry billions of dollars per year. System vendors and hospitals are pulling their hair out to solve this challenge. But here's the scoop. Caristix has the answer. That's why we're already en route to success, and that's why we're here. Our solution automates the work analysts do to understand system connections. Our software instantly shows analysts what's really going on in the data. Cut 50% off your deployment timeline. Cut tasks that don't add value. That truly resonates to an overloaded IT team. Cut risk out of those $100 million healthcare IT projects we see in the news. That too truly resonates to a hospital CIO. We launched our flagship software in November 2010, and we've signed customers in Canada and in the US since then. One customer cut a 4-hour task down to 3 minutes. Another one connected to a cloud system in days, not weeks. A third avoided a major risk because of our software. They discovered multiple conflicting data definitions prior to deployment. Caristix is 3 co-founders and 3 employees, all with hands-on experience in healthcare IT and up to 12 years of working together. We're mature and we've been there. We've got both technology and business in our DNA. Delivering the killer IP to address our opportunities, that's Jean-Luc and his team. They've got over 30 years of combined experience in healthcare IT. Going to market and selling, that's Savita and I. We've got over 25 years of combined experience in marketing and selling technology across the world. Our current IP addresses a market niche of about $200 million. Our target tackles even bigger problems around data and charts the way to a $30 billion market opportunity. Imagine a world where we leverage healthcare data for value, human value and business value. In the same way we leverage financial data on Wall Street or retail data at Walmart. Imagine connecting complex data sources to provide smarter care more compassionately and at lower cost. That's the world we want to live in, and that's the world Caristix will help to create. The bottom line, our software addresses the biggest technical risk factor with new equipment in hospitals. Thanks to Caristix software, the data just flows the way it should.